Welcome to 3M Oral Care's fourth live webinar in the series Infection Prevention. I'm Carissa Kerr, representing our Scientific Affairs and Education group and the moderator for this webinar. We are now going in depth regarding sterilization, the importance of it, device reprocessing, and monitoring. Thank you for joining us today. We really appreciate your commitment to your profession and education, and 3M does stand with you. You now have access to our last three webinars, Respiratory Protection 1 and 2, with Dr. Carrera and Dr. Durst, as well as webinar 3, Fit Testing with Eric Jacobson. The speaker for today's webinar, we're very excited to have Jamie Vadnais. Jamie is a graduate of the University of Wisconsin, River Falls, with a BS degree in biology, and also holds a BS in dental hygiene from the University of Minnesota. Since joining 3M, Jamie has held roles in dental sales, research, and development, and she is currently a clinical application engineer coordinating our 3M in-house dental operatory. Our panelist, who would join us during the Q&A portion at the end, Susan Flynn, is a certified sterile processing and distribution technician and is a member of several AAMI Sterilization Committee working groups. Her role at 3M includes providing education for customers and sales personnel on improving the performance of the sterilization process. Susan regularly speaks and writes self-study articles on topics related to device reprocessing. Our other panelist that will be joining us during the Q&A portion at the end is Dr. Carrera. She was our presenter from webinar 1. She studied at the University of Talca, Chile, and received her Doctor of Dental Science degree from University of Minnesota. This presentation is based on U.S. state or other country requirements. Please always consult user instructions and follow your local laws and regulations. Requirements can change in the future, and this webinar information is current as of this date. Digital recordings or reproduction is strictly prohibited without permission.
Hello and welcome. I'm Jamie Vadnais, and I'm so excited to be here today. As a dental professional myself and the OSHA officer for my previous office, as well as the 3M on-site dental facility, I know the importance of understanding the sterilization process, as well as the monitoring tools used to show effective sterilization, and just really how complex this topic can be. Sterilization is a key part of our infection control processes, and here at 3M, we wanted to provide some education to make it easier to navigate this important topic. So here's our agenda today. We'll start with some basic overview of the tabletop steam sterilizers. Then we'll discuss sterilization monitoring tools used to show effective sterilization. Next, we'll review some new solutions for steam sterilization monitoring. And finally, we'll discuss resources for sterilization of instruments and devices. So now more than ever, really staying up to date with your most current infection prevention protocols is really critical for patients and staff safety, as well as the confidence that everything is working properly. Our comprehensive portfolio of infection prevention solutions really covers all the aspects your practice needs to really minimize that risk of contamination and cross-contamination between your patients and staff, as well as the environment and instruments. So these are all the areas covered by the standard precautions guidelines for the US CDC, where the goal really is to minimize the risk of spreading disease. Device reprocessing and sterilization monitoring are a key part of the standard precautions to really ensure that your instruments and devices are sterile. So not sure if you're familiar with the Emergency Care Research Institute, or the ECRI, but it's a consumer report for healthcare. Late last year, they published their annual list of the top 10 technology hazards for 2020. And this was pre-COVID-19, of course. So we were really surprised to see that infection risks from sterile processing errors and medical and dental clinics made it to number 3 on their list. This just really shows that it's still a problem today. So you may or may not have heard of offices having sterilization failures, but this can really impact your business and reputation in a real way. It's not about the frequency of a failed sterilization process. It's the negative impact. The CDC guidelines say if you have a failed sterilization test, that you may not only have to contact each and every patient that you've seen since your last negative BI test, but also the local and state health authorities and inform them about this failure. These consequences really highlight the need for education for all dental professionals in the office and efficient monitoring solutions. By the end of our time today, I'm hoping to provide important information on sterilization monitoring and share potential solutions for your office. So this might be a refresher for you, but let's just really start with the basics, like an overview about grounding ourselves to talk about a few concepts in device reprocessing. When we talk about cleaning, cleaning is that process of removing that organic soil. You might do this by ultrasonic bath, doing manual cleaning in the office, or a few of you might have automated washers. Like you know, after cleaning, low levels of microorganisms are still present on these cleaned instruments. So these items are still infectious. Disinfection is a process to destroy microorganisms, often using chemical disinfectants. Disinfection is less lethal than sterilization and does not kill all bacterial spores. So while disinfection is appropriate for items that touch intact skin or disinfecting items in the clinic, it's not appropriate for critical items. And by critical items, I mean those reusable instruments that cross the mucosal membrane or enter the bloodstream, and those instruments should be sterilized between patient uses. Sterilization is the process that destroys all microorganisms, including bacterial spores. So sterilization of critical instruments is a very important step in a clinic's infection prevention process in order to really help minimize patient-to-patient disease transmission. Sterilization areas should have a unidirectional flow from dirty to sterile. Today, specifically, we are talking about steam sterilization and sterilization monitoring. But I wanted to show this slide to really reinforce that sterilization cannot be effective unless meticulous cleaning is done first. So the go-to method for sterilization for dental offices as well as hospitals across the world are steam sterilizers. Steam sterilization is a very old and well understood technology. Its value is that it has a fast cycle time, so it can turn over instruments quickly, and it's effective in killing all microorganisms, including bacterial spores. It's relatively inexpensive, and it's easy to use, and you're able to actually package your items so that it can maintain sterility until the time of use. And finally, there's no hazardous residues after sterilization. Some of the methods of chemical sterilization have residues that are of a concern for the person performing sterilization or the patient. So every method of sterilization has critical variables that are required to achieve an effective sterilization process. In the case of steam sterilization, those variables are time, temperature, and the presence of saturated steam. If any one of these variables are missing, then the cycle will not be effective, meaning the devices might not be sterile. So while the critical variables are time, temperature, and the presence of saturated steam, the sterilization cycles usually begin with the removal of air in the chamber, as well as the package load items. Think of air as the enemy for effective steam sterilization. Different sterilizers use different methods to get rid of that air. There are two big categories: gravity displacement and dynamic air removal sterilizers. Gravity displacement is when steam goes into the top of the chamber and it's driven out the bottom. Dynamic air removal has two subcategories, which are the pre-vacuum and the steam flush pressure pulse, or the SFPP. Pre-vacuum is a series of vacuum pulse pressure pulses to drive the air out. You will need an extra hookup for a vacuum for this specific type of sterilizer. Steam flush pressure pulse, or SFPP, is a positive pressure steam pulses with a gravity flush. In the dental industry, the most common is the dynamic air removal, in particular, the steam flush pressure pulse, or the SFPP. However, it is important to know the cycle type because it affects the monitoring tools that can be used, but more importantly, how to process instruments per the manufacturer's instructions for use. So most offices, kind of like the polling question here, are really not sure of what type of tabletop steam sterilizers they use, nor do they know what type of air removal method they have. Even at 3M, when opening the on-site dental facility, I had to look into the manual to really determine what type of air removal method was in our clinic. So tabletop steam sterilizers are defined as compact, and we use distilled water, and the sterilizer will generate its own steam. Most commonly used in the US dental office would be the steam flush pressure pulse, which you can see is the Midmark M series or the Cycan Statum. There are many models available from a variety of manufacturers. As you can see, each manufacturer has different cycle types depending on the specific series. Sterile is defined as the absence of all living microorganisms. The goal of sterilization is to kill any microorganism that might be on those cleaned instruments. But the problem is you can't see sterility. So really, how are we maintaining and monitoring to really determine if we had effective sterilization? So these are the monitoring tools used in dental offices to gather information about the sterilization process to show if it was effective. They include physical monitors, biological indicators, or BIs, and chemical indicators, or CIs. Mechanical or physical monitors is physically having a printer tape or digital display on the sterilizer itself. So this is when every time you run that sterilizer, that this physically monitors the system, and it will have a specific printout to let you know if that sterilization cycle was effective. Biological indicators, or BIs, are to ensure that your sterilizer is working to kill all living microorganisms, including bacterial spores. You may be familiar with BIs as either the self-contained BIs, like the one that's on the image on the slide here, or a spore strip that an office will actually mail in. Chemical indicators, or CIs, monitor the presence of one or more of the critical variables of time, temperature, and presence of saturated steam. CIs can be broken down into three categories of process exposure indicators, internal chemical indicators, and sterilizer test indicators. Specifically today, we are going to be talking about BIs and CIs and the solution 3M has for you. So let's start with CIs, which again monitor the presence of one or more of the critical variables, which are that time, temperature, and presence of saturated steam. It's important to know that not all CIs measure all these critical variables. The process or exposure indicator is located on the outside of every package. This tells us that the package was steamed, but it doesn't tell you if the package is sterile. The internal CI is located on the inside of every package. This verifies, in the case of steam sterilization, that steam has penetrated inside of every pouch, package, or cassette. These indicators respond to a different number of the critical variables, which is classified as a specific type, which we'll actually go into that in the next few slides. Then there's the sterilizer test indicator, or the Bowie-Dick test, which are really used for the pre-vacuum sterilizers and run every day to make sure that the vacuum system is running properly. Know that in a dental setting, a pre-vac sterilizer can be used, which we could see from that polling. A few of you are using that, but it's not always the most common one used. So just wanted you to be familiar with this test. For process exposure indicators, it's a quick visual indicator to show the presence of steam, but it doesn't tell us if the items were sterilized. You might be asking yourself, why is it important for an office to use external CIs if you're using internal CIs and BIs? Well, how many times have you woke up in the morning and gone to empty the dishwasher and you were unsure if the cycle was run? The way I always know is if there's a little bit of water on tops of the glasses. Think of this indicator as the water on top of the glasses. When a dental professional opens up that sterilizer in the morning, they can immediately know if the cycle ran. If the lines are off-white, they know someone forgot to run the cycle. If the lines are dark, then they don't have to share a few words with the night crew. I know I've been in this situation before where I was unloading the sterilizer in the morning and started to stack the cassette and then realizing the tape had not changed. And really getting that feeling of, thank goodness there was something very clear to give me an indication that the cycle was not run. So 3M offers 1355 lead-free process exposure indicator tape. This tape has a pre-printed indicator ink line that turns dark upon exposure to steam, so it's easy to identify if the cycle ran. As well as it has an adhesive technology that is clinically preferred. So just like dental professionals who follow guidelines and standards, manufacturers also follow certain types of standards when developing products. ISO 11140 Part 1 is an international standard which provides performance specifications for CIs. There are 6 types based on characteristics and intended use of the indicator. Each type of CI simply has its own job to do and has a unique performance specifications per this ISO standard. And first looking at this, type 1 through type 6, you might think there's a ranking, like type 2 is better than type 5, or type 6 is better than type 1. These are not rankings, but instead categories for variables that they measure. Type 1 is a process or exposure indicator. It's on the outside of every package, letting us know that steam was present, but it certainly doesn't tell us about the quality of the sterilization cycle, and it doesn't tell us that the items are sterile. For example, I use the peel pouches that have a process indicator printed on the outside as well as on the inside of the pouch. Now again, it just measures that steam was present. Even though my package may have an indicator inside, we should still and should always be using an internal indicator of a type 3, 4, 5, or 6 to measure the critical variables. Type 2 is a specific or a special indicator, and it's used for a Bowie-Dick test for pre-vac sterilizers to make sure that the vacuum is working properly. Type 3, 4, 5, and 6 may all be used as an internal CI. We mentioned different sterilizer methods have certain critical variables, and these indicators will respond to different numbers of those variables. So the American National Standards for ANI SD 79, which is a standard for sterilization assurance in healthcare facilities, indicate one or more internal CI should be used in every cassette or package, which could be a type 3, 4, 5, or 6, but would prefer type 5 or 6. So specifically today, we are going to be talking about a type 5 indicator. At 3M, we recommend type 5 for the internal CI application. This type may be new to us in the dental industry, but it's widely used in hospitals around the world. Type 5 CIs are called integrators because they are required to integrate the critical variables of time, temperature, and presence of saturated steam. Per the ISO standard, it has to take as long for the type 5 indicator to reach an acceptable result as it takes to kill bacterial spores, meaning the performance of a type 5 indicator also correlates with the performance of a biological indicator in ideal saturated steam conditions. So this CI has a broad indication for use, which eliminates the need to stock multiple internal CIs in your office, because the type 6 indicator, by contrast, is usually indicated for a specific cycle type. So we really feel type 5 is the best bet to get the job done and to tell you a lot about the sterilization cycle. The product we'll be introducing to the portfolio is the 3M ATEST Steam Chemical Integrator, which is a type 5 integrating CI that is to be used in every package. As the dental professional opens every instrument package, they can easily interpret if that line falls into reject or accept after the sterilization process, instead of trying to interpret a color change like other CIs on the market. One other note, coming this fall, we're going to be launching the CI with some new design improvements, where not only are the colors bright with red correlating with fail and green with pass, but also the back of the CIs can easily be seen in a cassette or pouch with the red 3M print. So I just wanted you to be aware of the two different design versions. CIs contain a large number of viable microorganisms called Geobacillus stereothermophilus. This type of microorganism is very resistant to the sterilization process. The concept with a BI is that if you're able to kill this very resistant microorganism within the BI, then there's a high probability that any microorganism on your clean instruments, which is less resistant, would also be killed. You may be familiar with BIs as either the spore strips that your office would mail in, or self-contained BIs where your office would incubate on site. More than 3/4 of the dental market still uses the mail-in spore strips. This process sample is mailed back to a lab where the spore strip is transferred to growth media and incubated. Results are provided 3 to 7 days later. About a fourth of the market does use a self-contained BI and incubates in the office. A portion of this segment already uses the ATEST 1261 or 1262 BIs with the round ATEST incubator. These systems provide a visual result after 24 or 48 hours of incubation. So a conventional self-contained BI depends on a color change that is visible to the naked eye. With every process BI, we must run a control which demonstrates that the spores within the BI are viable or alive. This BI is pulled directly from the box. It's activated and placed into the incubator. With the control, we will want to observe a positive color change because it indicates the spores were alive. So going from that purple to yellow after 48 hours of incubation. What happens is the bacteria is exposed to the growth media or the food. When it's activated and it's placed into an incubator that has the temperature to support the growth of the Geobacillus stereothermophilus. The spores begin to germinate and replicate. They then give off an acid waste that trips a pH color change in the media, and it changes it to yellow. So while we want our control to have this pH color change to yellow for our process BIs, we will not want this, and we'll want it to stay that purple color to indicate a successful sterilization cycle. If a color change is observed for a process BI, it would indicate survival of the bacteria Geobacillus stereothermophilus, which means your sterilization process failed due to not being able to kill all the bacteria within the BI. This is never a good day when a failed sterilization cycle is observed. As I mentioned, this result is the final result after 48 hours of incubation. So 48 hours is a really long time to find out your sterilizer is not working properly. So when doing a BI process challenge device or a PCD, you'll want to process the BI the same way your offices are running instruments, in the same pouches or the same cassettes that you're currently using. BI should be placed in part of the sterilizer that would be the most difficult to sterilize. Example would be a cold point by the door, but it's really important to just check with the sterilizer's manufacturer on this. In the US, weekly BI monitoring is the minimum, but AAMI SD 79, which is the standard for sterilization assurance for healthcare facilities, is suggesting daily monitoring to assure effective sterilization. So this slide shows the guidance that were given from the CDC and the AAMI SD 79 for specifically BIs. The theme here is to do BIs weekly, but preferably daily. And some offices are already following this best practice. So coming back to this slide, in my most recent OSHA and infection control training, if you have a failed BI, the guidance is to run that BI again. Now that could be up to 14 days to get the final confirmation if your sterilizer is working properly. Could you imagine the uncertainty of a failed test? Would your offices pull those instruments and quarantine them until you get that second result? Are you even equipped with enough instruments to allow for that? Probably not. And this would be a very unsettling time for a dental office. In summary, the dental industry is ready for a faster way to monitor their sterilizers and minimize that risk that non-sterile instruments are being used on patients. So that brings me to introduce our new product that I'm very excited about. It's the 3M ATEST Mini Auto Reader 490M. This mini auto reader can give you your biological indicator results in just 24 minutes. Let me say that again. This new mini auto reader can provide your results of your biological indicator in just 24 minutes. No more waiting anywhere from 24 hours to 7 days to ensure that your sterilizer is working properly. You get your results in just 24 minutes. So let's get started by talking about the features of this new mini auto reader. The technology has been around in hospitals for years, and so we wanted to bring this into the dental industry. So we designed this mini auto reader with 4 incubation wells, which is perfect for a dental office or a medical clinic. It's the size of a common smartphone, so really great for offices where space is a hot commodity. In addition to its compact design, it has an incubation temperature of 60 degrees C to help support the growth of the Geobacillus stereothermophilus. And you're able to get those results in just 24 minutes for steam sterilizers. And finally, it has a large display so you can quickly see how much time is left or the actual result of your test by walking by. No more having to pick up your self-contained BI and determine if there was a color change. This display tells you if your sterilization cycle was successful or not. So this is how the technology works. To the purple glass ampule of growth media, we added a non-fluorescent substrate. After sterilization, you would break this glass ampule, exposing the spores to this media. If the spores survive the sterilization cycle, as they begin to germinate and grow, what they do is they naturally produce an enzyme that is represented by the E in the pictogram. This enzyme breaks down the non-fluorescent substrate in the media and releases fluorescence. These fluorescents can't be seen by the human eye, but it's detected by this auto reader. So not only does this mini auto reader serve as an incubator, but it also serves as a reader that reports the results to the end user. Also, just to note, if you leave your control BI in the mini auto reader over the weekend, you could see a visual color change after incubation of 48 hours. But just know this brings no value and is not necessary for determining your final result. The auto reader display and 24-minute fluorescent result is the final FDA cleared result. So within the mini auto reader, you will need to determine which specific type of BI the sterilizer will use. 3M has 2 options for these super rapid readout BIs, which are either the 1491 or the 1492V. In order to choose your super rapid readout, you will need to know what type of method of air removal your office's steam sterilizer uses. Remember, the most commonly used is the steam sterilizers in a dental office would be the dynamic air removal using the steam flush pressure pulse, or the SFPP. You will need to make sure that it correlates with the temperature and time on this table to determine if this is the right BI for your office's sterilizer. If the cycle temperature and time of exposure for the sterilizer does not fall within these guidelines, please contact your 3M sales rep or call our customer care line to determine what BI would work best for your specific cycle type. So it's a simple process. You let the BI cool, you activate it to combine the growth media with the bacteria, you flick and you place into the well. It's important to know that once the BI is planted into the incubation well, we don't want to touch it until the final result is displayed, showing the test is complete. With any BI test system, it's necessary to run a positive control, like we talked about earlier. You will have to run a positive control every time you are running a process BI to really verify that your system is working. Remember, a positive control is a BI that is taken directly out of the box and is not placed into the sterilizer. It is activated using the same steps that we just reviewed and incubated in any of the wells of the mini autoreader. The control BI should have the same lot number as the process BI. Basically, what the process BI and the autoreader make sure of is that your sterilization process is working correctly. And the positive control makes sure that the monitoring system is working properly. The mini autoreader display informs the user about the status of the incubating BIs. After a BI is placed into the incubation well, the remaining minutes of incubation are displayed under the BI. So what you are seeing starting from left to right would first be a positive control. You can tell by the pink top, which indicates that it was not exposed to steam and it's been taken straight out of the box. Next is a negative result, indicating an acceptable sterilization cycle. The following one is a test with 24 minutes remaining. And finally, a test with 24 minutes remaining, meaning it was just placed into the well. The results continues to be displayed until the BI is removed from the autoreader for longer than 10 seconds. The mini autoreader comes with the option of connecting to a PC, where you can actually record all your results with the A-Test Connect app. This app will allow you to view your current status of your incubating BIs when you're connected to your PC, as well as creating and viewing BI records. And it also enables any future software upgrades for the autoreader itself. You can have the option to be able to record on your computer instead of having your documentation in a 3-ring binder. So it's just a great option to be able to have. So that concludes my presentation today. Thank you for your time and attention. At this time, I'll turn it back over to the moderator, Carissa, for some discussion on resources and Q&A.
Great. Thank you so much, Jamie, for sharing this critical information with us today. 3M Sterilizer Monitoring Solutions does help give you confidence for your practice and for your patients. Here at 3M, we want to support you and your practice in giving you confidence that your sterilizers are working properly and being able to answer any questions you may have. But if your preference is to navigate for answers on your own, please go to our 2 web pages, www.3m.com/dental protection or www.3m.com/coronavirus. We have a significant amount of resources and videos at your fingertips within those web pages, as well as on our Healthcare Academy. Please do watch our previous 3 webinars for additional infection prevention education. They're readily available and they've been recently published. So now Susan and Dr. Carrera will be joining us for our live Q&A session. So welcome, Susan and Carola. Our first question that came through is a great one. What should you do if your Class 5 integrator passes and your biological monitoring fails?
Hey, Carissa, this is Susan. I'll take that one. So that is a very good question. And you know, we use a suite of monitoring products. There's a phrase in hospitals that we use, if in doubt, throw it out. So if anything indicates that there might have been a sterilization process failure, you of course would not use those items for patient use. But specifically to this question, the biological indicator contains live bacterial spores. So if your BI fails, that demonstrates the cycle was not lethal, and you would certainly not use those load items. We do see it both ways, however. So an internal chemical indicator, which is placed inside a cassette or a peel pouch, could pick up improper loading or overloading of the sterilizer. You may still see a negative biological indicator. So we see it both ways. In general, though, if you had a passing type 5 indicator inside an individual item, but the BI had failed, you would still reject and reprocess that item.
Great, thank you so much, Susan. Another question that came through, they have a new person at their clinic, and should they be doing a daily Bowie-Dick test in each sterilizer? Would that be accurate or correct?
Oh, that's a funny question, and we often hear when staff moves from place to place, they question things because they did things differently elsewhere. So as Jamie mentioned this morning, Bowie-Dick tests are a special test done each day in pre-vacuum sterilizers before the first load of instruments to verify the vacuum system is working properly. So if your clinic has a pre-vac sterilizer, then yes, a daily Bowie-Dick test would be part of your testing program. I was actually surprised in the polling results for how many people responded that they did have pre-vacuum sterilizers. In my experience, most tabletop sterilizers in US clinics use the gravity or steam flush pressure pulse method of air removal and therefore don't require a Bowie-Dick test. So bottom line, check the operator's manual for your sterilizer to see whether they recommend a daily Bowie-Dick test.
Great, yeah, the polling question result for pre-vacuum was 17%. So good information. Another question for you, Susan. We just had our steam sterilizer repaired. Is there any special testing that we should be doing, anything necessary before using it?
Oh, that's another good question. So Jamie did a fantastic job reviewing routine testing, but there's a whole other section in Amy's SD79 that provides recommendations on qualification testing. So sterilizers should be qualified using a biological indicator after they're installed, relocated, have a major repair, or after a sterilization process failure. And your service tech should let you know after repair if they consider a major repair, as that will trigger you to do qualification testing. There's specific guidance on how to do it in SD79, section 13.8, but basically you run 3 consecutive cycles, each with a biological indicator in a representative process challenge device. And the sterilizer is considered qualified and ready to reprocess instruments for patient use if you get negative results for the biological indicators from those 3 consecutive tests. So you can see that having a biological with a faster result is really advantageous when doing qualification testing, as you can get the sterilizer back into service sooner. You may want to check with the operator's manual to see if they have any specific instructions on how to complete qualification testing. For example, if your sterilizer can run multiple cycle types, they might recommend qualifying each cycle type using 3 consecutive biological indicators.
Thank you, Susan. Another question that came in is a dental professional does use the ATEST 48-hour biological indicator or BI. If they test the sterilizer like on a Thursday or Friday, does someone then have to come in over the weekend to see those BI results?
Oh, okay, that's a good question. And yeah, in the polling, it did look like there was a fair number of folks using that product. So our 48-hour BIs have enough media in them, obviously, to be read at 48 hours, and you'll usually get away with it after the weekend as well, as long as there's enough media remaining that you can determine, is it purple, indicating a successful cycle, or yellow, indicating a failed cycle, then you're fine. After a long weekend, it gets dicey and I wouldn't recommend it. So 3M steam biological indicators can actually be left at room temperature after sterilization for up to 7 days before being activated and incubated. This really isn't a best practice, however, as you want to know as soon as possible if you've had a sterilization failure. So that new mini autoreader that Jamie mentioned offers a 24-minute time to result and would be another great option to consider, because in that case, at the end of the day, if you don't have time to wait for your result, you could activate the BI, leave it in the mini auto reader, and then the next morning, the result will be there for staff to document, whether the next morning is Friday morning or Monday morning after a weekend.
Thank you so much to Jamie, Susan, and Carola. And also thanks to everyone that joined us today. Please do join us for upcoming webinars as they are released, or feel free to view any of our recordings on the Healthcare Academy. Thank you.